Okay, today a colleague asked me, how come this patient is having difficulty in breathing and the head of bed is elevated and he is also on high flow oxygen? What could be the problem? Do we need to increase the volume of oxygen? Is he lacking oxygen, or we need to increase oxygen? No, the answer is you should not increase oxygen. This is what happened in this patient. This is a 65-year-old male with a chronic liver failure, having difficulty breathing. He's on high flow oxygen, but when the head of bed is elevated, he's still having difficulty breathing. What could be causing this one here? One, the condition is called hepatopulmonary syndrome. Hepato means liver and pulmonary means the lung. Is a condition which happens in liver failure. When a liver fails, it also fails to do one of its core functions, which is eliminating particles, or let me use elements. I'm using simple terms because I know some of you are not medics. The liver fails to perform one of its core functions, which is eliminating particles from the blood. And one of those particles is called nitric oxide. So this nitric oxide, which is not being eliminated by the liver, accumulates in the body. And the easiest place being accumulated is the lungs, because the lung is now trying to take up the responsibility of the liver to clean the nitric oxide away from the body through the breath. Now, that depositing of nitric oxide in the lungs causes the vessels within the lungs to expand, to vasodilate. The normal size is usually between 8 to 15 micrometers, but nitric oxide make those vessels to dilate to between 30 to even 100 micrometers, and this is so huge. No, those enlarged vessels therefore allows the blood to move in between them at a faster rate, so that the blood is not able to pick oxygen from the lungs, even if the lungs are well supplied by oxygen. So the blood passes very fast. Others pick only up a little amount of oxygen. So even though the lungs is adequately oxygenated, the blood will not pick that oxygen from the lungs. And therefore, this person will have difficulty in breathing, even if you increase the flow or the volume of the oxygen that you're giving to this patient.